Addiction takes a terrible toll on the health and well-being of those afflicted and those around them. In 2022, there were nearly 110,000 deaths due to opioid overdoses. The number of overdose deaths is increasing by 17 to 30% in recent years. Alcohol-related causes of death are estimated at 140,000 people per year. So alcohol is now the fourth leading preventable cause of death, behind tobacco, poor diet and physical inactivity, and illegal drugs. Alcohol-related deaths, like opioid deaths, are continuing to increase, with alcohol deaths increasing about 12.5% for men and 15% for women annually. Now, there are a number of medications, as well as behavioral therapy and support groups, to help individuals control their addictions, but these are not fully effective in a large number of people, and the individuals are at risk of the addiction returning during a relapse. Scientists are researching a potential cure that could permanently treat addiction, but to get the benefits of the treatment, you would need to make changes to your DNA. In this week's Ethical Dilemma in Science, we're going to ask the question, should we use gene therapy to alter DNA and treat addiction? Addiction is a complex brain disease in which normal brain activity is disrupted by drug or alcohol use. In a healthy brain, certain activities are rewarded by the release of brain chemicals promoting feelings of pleasure. Drug and alcohol use interferes with the brain's ability to feel pleasure from healthy, desirable activities to the point that feelings of comfort and pleasure are only achieved through the use of drugs or alcohol. Addiction also results in damage to the important decision-making region at the front of the brain. This region evaluates the consequences of an activity so that people with severe addictions are unable to realize the detrimental effects of drug and alcohol use. Now, on the slide, we've got an artist rendition basically showing brain activity levels. And so in a healthy brain, what we've got is a situation where we've got a lot of reds and yellows, indicating a high level of activity normally found within the brain. However, in a person with addiction, we're seeing a very dramatic decrease in the amount of activity, the normal brain activity that's going to be occurring. And so we're seeing that the yellows and the reds that are present in the healthy brain are missing in the addicted brain. Instead, we're seeing kind of greens and blues, which represents a lower level of brain activity. Addiction is the result of complex interactions between a person's DNA, basically the genetic component of the disease, and the environment. And this is sometimes referred to as nature and nurture. Now, there are environmental cues, which are factors in a person's daily life that either triggers cravings or activate memories of situations or locations when a person resorted to drug or alcohol use. The drug use, paired with the environmental cues, can strengthen memories, making it harder to fight how the brain seeks the addictive behavior. In this talk, we're focusing on addiction to drugs and alcohol. And so these can be considered substance use disorders. And so substance use disorders are heritable, so they can be passed from parent to offspring. Now, scientists estimate that over half of an individual's susceptibility to drug addiction is linked to their DNA. Recent studies looking at the DNA of over 1 million people determined that there are specific regions of the DNA that are risk factors for substance abuse disorders such as alcohol, tobacco, and opioids. Now, DNA is not the sole determinant, since multiple genes and environmental factors all impact on a person's susceptibility to addiction. Still, this genetic predisposition plays a powerful role in determining whether a person could become addicted, and this could serve as a target for addiction treatment. The current treatments for addiction include support groups, cognitive therapy, and medications, either in inpatient setting or an outpatient setting. Now, support groups could be examples of 12-step programs such as Alcoholics Anonymous, and Narcotics Anonymous. Cognitive therapy would involve professional mental health and addiction counselors that work with a patient to address the causes of their addiction. And then finally, clinicians can prescribe medications. And so these daily medications, things like naltrexone or Topamax, can be used as a daily pill to limit the cravings, or they could be in the form of injections for longer action. In addition, we have the drug naloxone, which is now available as Narcan, which can reverse opioid overdoses. So the current therapies of support groups and cognitive therapy and medications work with some people, but is not effective at treating the addiction in others. Even those people that it does seem to work, they are at risk for relapse and return of the addiction at a later period in time. And so scientists are looking for a more permanent solution or a more permanent cure for addiction. And one of the ways in which they're pursuing this is to look at gene therapy. So what is gene therapy? Gene therapy is going to be a process in which scientists use molecular tools to go in and modify a person's DNA. Now, genetic modification is usually focused on one of three strategies. The first is to recognize a disease-causing gene, so basically a damaged piece of the DNA, and replacing that incorrect or damaged piece of DNA with a healthy copy of the gene, a healthy copy of the DNA that would repair that function of the disease-causing gene. Another avenue of research and using gene therapy is to inactivate a disease-causing gene. So taking a gene that is not working properly, a piece of DNA that is not doing what it needs to do, and basically turning it off so that it can't cause additional problems in the future. And then finally, the last strategy for gene therapy is to introduce a new or modified gene into the body in an effort to treat the disease. So what we've got on this slide is a brief summary of the process of gene therapy. And basically, we can do this either inside of an individual. With an individual, we could use like some type of method of getting the genetic material into the cells. It's often using like a modified cold virus or a lipid nanoparticle that would then be injected into an individual that would modify the DNA within the individual's own cells. The alternative strategy is to do that genetic modification outside of the body, in which they can take a person's cells out of the body, put them into a laboratory setting, change their DNA, and then return those modified cells back into the individual. Now, when we take a look at gene therapy, it's been discussed for and researched for many years, but the first approved gene therapy occurred in the European Union in 2012, and the first approved gene therapy in the United States was approved in 2018. And so we're looking at relatively new cures or relatively new methods of treating diseases. Now, currently, the gene therapy protocols for treating addiction are still at the research stage. But even though they are in the research stage being looked at in animal models, they look very promising. Examples of these studies include a 2017 study in which they showed that gene therapy was able to prevent methamphetamine from getting into the brain and giving the patient pleasurable feelings. In this case, the patient was an animal. And the thought is that this gene therapy can prevent the patient from feeling high and could break the cycle of craving for the drug. In another study in 2018 looking at cocaine addiction, they used gene therapy in order to produce a modified enzyme that would then very efficiently break down cocaine when it was in the bloodstream. And this resulted in eliminating the cocaine before it would have the effect on the brain. And this resulted in lower cravings for cocaine, and it actually protected individuals against cocaine overdoses. And then finally, and most excitingly, in August of 2023, there was a published study that showed that gene therapy reduced the self-administration of alcohol by monkeys by over 90%. And it actually reset the brain activity and the brain chemicals to a normal level, which were maintained for at least a year. So these are still being done. These gene therapy protocols and experiments are still being done in animals, but we're getting closer and closer to human clinical studies and potentially a treatment for humans in the next 5 or 10 years. Limiting the excitement of gene therapy for the treatment of disease is the observation that the costs of gene therapy may be beyond what individual patients and their insurance companies are able to pay. In November 2022, the Food and Drug Administration approved a gene therapy treatment for a genetic form of hemophilia B, a condition that severely impairs blood clotting and puts the individual at risk of uncontrolled bleeding. The treatment used a modified virus to change the DNA of liver cells in order for these liver cells to produce the blood clotting protein known as factor IX. However, the one-term treatment cost for this gene therapy is $3.5 million. Now, it's estimated that the cost of treatment of an adult with hemophilia B is between $700,000 and $800,000 per year. And so therefore, the treatment would save an estimated $5 to $5.8 million per patient who would normally be receiving these injections of factor IX once or twice a week. Now, the Food and Drug Administration is evaluating the results of a gene therapy clinical trial for a treatment for a cure for sickle cell anemia, and an institute that looks at the cost effectiveness of drugs is estimating that a gene therapy treatment for sickle cell anemia could be priced between $1.35 and $2 million. Now, these miraculous cures can allow a sick patient to become well, reduce their annual medical costs, and often return them to a higher quality of life and the workplace. But will these gene therapy treatments only be available to the very rich that can afford them? How do you balance the need to support innovation by the pharmaceutical company that is a business and must generate a profit in order to stay in business with the needs of the patients that need their medication, or in this case, their gene therapy? In this week's Ethical Dilemma in Science, we're asking the question, should we use gene therapy to alter DNA and treat addiction? Should addiction be treated with a permanent treatment that cannot be reversed? It can't be reversed if the person changes their mind. It can't be reversed if there are side effects that develop as a result of that treatment. Should health insurance companies cover these expensive treatments? And then finally, should other conditions traditionally treated with therapy and/or medication be cured with gene therapy if an associated gene can be identified? Thank you for listening to this week's Ethical Dilemma in Science. As always, please see the description below for additional information and references. Thank you, and have a great week.